Okay, hi everyone. I'm here with Dr. Christy Hughes, who I've known for many years, and we've taught together in many places. And she has been very influential in the field of functional medicine. She has served as the director of medical education at different levels all throughout development of functional medicine, and helped create many of the programs, and is instrumental in the growth of functional medicine. And, by the way, every year when they ask for a nominee for the Linus Pauling Award for Institute of Functional Medicine, they always nominate you every single year. Yes. So just so you know that.
Oh my gosh. Okay. Well, that's the bigger honor than actually winning the award. Are you kidding me? I'll take it. That is like the nicest thing I heard all year.
Oh, but and then last time we were together, we were in Ireland and we were teaching functional medicine. And I really wanted you to speak to our community because you've seen all levels of functional medicine development. You've seen people coming into functional medicine. You've seen functional medicine come in from the burnt out classical physician who's just trying to figure out what to do for those patients and for themselves. You've seen naturopathic students who you see transition into trying to have a system to implement their natural medicine, concept functional medicine. You've seen all different professionals, chiropractors, nutritionists, health coaches, everything. You've had a clinic where you've trained them. You have residency programs. You've kind of done it all. You've been all over the world. You've pretty much taught all over Europe, Asia, US, right?
And every single inaugural AFMCP in every country and every city so far to date. So
right. So this is why I really wanted to get your expertise, your opinion, because you have this perspective really very few people have, is like how it's grown, what you see as weaknesses, limitations, strengths. We obviously have a community of people now dedicating themselves to trying to learn functional medicine. They see a role for their practice to evolve into that model. So let's talk about, if you don't mind, I'd like to kind of pick your brain on a few topics first. First of all, when you see people jump into the functional medicine community, what do you think is the biggest issue with them really understanding the concepts and jumping in and becoming proficient in it?
Yeah, I think in the beginning, the nomenclature around it can be a little bit tricky because you're not really sure how to position this world of CAM, complementary alternative medicine, integrative medicine, naturopathic medicine, clinical nutrition. There's all these words out there, right? And many of them can really subscribe to what is reduced down to the simplicity of what's called root cause medicine, right? Which is where the philosophical approach, the attitude that the clinician takes is more of a medical detective, where the goal is to work to find the cause or the cause of the cause or the cause of the cause of the cause, right? And do that depth level of work, so that you can hopefully help transform the healing process for that patient. So it's, I think one of the valuable pieces of where I've gotten to be in both my clinical practice and my education practice is, I've had the privilege of working on collaboration teams of many different practitioners who've come to this point in healthcare seeking root cause, seeking cause care, right? Really wanting to know more about how to help support a healing response. So many practitioners, whether they have come from a conventional approach or they've come through a nutrition perspective, or they're coming even from a coaching perspective or a therapy-based directive or a specialty, right? Dermatology, oncology, right? We have it all in the functional medicine sphere. Right. What's pretty remarkable is many practitioners come to the table with their unique background and their training and their credentialing. Right. And then they take that degree and their current or previous experience in medicine, and they layer on top of that the approach called functional medicine, which is very specific and is really chiseled out, or I would say carved out amongst this field, this wider, bigger field of natural medicine. Right, because functional medicine is definable. There's a specific structure that's commonly being used in the functional medicine world, right? And that sort of brought to light in the last 20 years, led and championed by some of the founders of the functional medicine movement, and really modeled and taught at the Institute for Functional Medicine, right? So there's multiple places that people go to learn functional medicine, but there are a couple of key themes that really underlie that training. And the big deal is the approach. Right? It's the approach that you're taking to healthcare, how you're thinking about the patient, and ultimately that you're thinking in systems, that you're thinking about systems-based care, you're thinking about unique personalized needs that particular individual may have and hold, and you're open to a whole world of therapeutic interventions outside of just looking at drug and therapy or pharma.
Right. So, okay, that's a good answer for functional medicine. Let's talk about the reality is what we see as educators. Like we'll see some people come in, whether it's education or in clinical practice, we'll see someone has gone to see a functional medicine practitioner and they've ended up having thousands of laboratory tests spent that are totally unnecessary. And they have lots like overdose and supplements. Like so the biggest tell for me when I see a file come in from seeing a functional medicine practitioner or a new person is they're just ordering way too many tests, thinking that the more tests they order, the better they are at functional medicine. And then, well, let's just cover everything. Let's put a supplement for your gut. Let's put something for your detox, put something for everything. And then they end up with tons of supplements. And the patient is frustrated, confused. They don't know what's going on. And it's like every time they see their functional medicine practitioner, there's another lab test or another supplement. And they're kind of frustrated, just like when they see a conventional physician, every time they see him, they're getting on a new drug. And this is the level I think I see happen with a lot of new people in functional medicine. And I wanted to get your thoughts on how often you see that. And when you see that, what does that tell you? What kind of suggestions do you have when you see that for practitioners?
Yeah, first of all, I'd say that's the perfect example of what is not practicing functional medicine. Right. And I think that unfortunately is part of is a sort of a hang on to some of the early years of the development of where functional medicine truly emerged from. Right. Because for many years, the term, orthomolecular approaches or personalized medicine emerged. So did functional medicine, and kind of the term can serve some pretty generic associations. Right. There is obviously there's a bad hang and tag connected to practitioners whose interpretation of functional medicine is order a lot of expensive tests and then give a lot of supplements. I mean, that's not functional medicine, right? The key to functional medicine is that you're understanding that there's really two components. One is the science, which we obviously spoke to, which is why the field emerged. But two, it's also the art of how you approach a patient, right? The way that you're embracing or you're looking at their care. Right. So in functional medicine, you're going to be looking at observing, identifying the clinical picture and understanding the diagnosis and how that was arrived at, but you're not going to stop there. In functional medicine, you're going to be looking at systems. You're going to be looking at where are some of the breakdowns and unique attributes that go back to and they cause either blockages or obstacles to healing. And you're going to go back to and you're going to address those systems in the body. So it might be oxidative stress struggles that are present. Maybe you are going to be looking at methylation issues inside of a bigger picture. Maybe there are challenges or struggles, the patient's living in a mold environment, or maybe there's a history of tick-borne disease or other infectious disease agents, right? Or maybe there's compromisation in how this person can respond to stress and manage it. And I think the key with functional medicine is taking an effective timeline, understanding how did the patient arrive at this point? What might we want to know about their genetic uniqueness, their susceptibility, and their family history? And then in observing their storyline, what do we know about our environmental relationship between our genes, our food, and our environment, and where they got sick and how they got sick, right? So when you're taking a functional medicine history, you're using art and science. And I think here, the on-ramp to doing functional medicine to teach, I think there's a lot of people that fall through the cracks here. They rely too heavy in one direction or the other. They overly rely on testing because they don't think that they can figure it out. Every one of us, no matter what medical school you went to, every one of us was trained to try to arrive at the diagnosis before you start ordering labs, right? Understand the clinical picture, right? And have a good, solid working diagnosis, confirm that with your labs.
So just to like help people understand, if you're out there and you're ordering countless amounts of lab tests, that's not really doing specific functional medicine. It's really not the best approach. And if your patient's ending up with 30, 40 supplements, that's also maybe not efficient in what you're doing. And we both see that as educators. And I think for some people, they have to really understand when if they're in functional medicine, that's really poor practice. And it really is a waste of time. And eventually over time, it's going to lose your trust with your patient, because when those patients walk into your office or my office where they see another functional medicine practitioner, they're like, I know this functional medicine thing makes sense, but I like, what can I, like, they bring in their stack of labs and stuff, and it's very frustrating. So we know we have that community, and that community is, obviously still very green, very new, and it takes time to kind of hone your skills in and do something. And then the other part of this I see is, with functional medicine, I want to get your opinion on this, is you see some functional medicine people that they get biased in what helped them. So if they had mold issues, then everyone they see will be first through mold eyes, right? Yeah. Yep. Or if they had a gut issue and they treated their gut, everyone is going to be seen through that, or an adrenal issue. And then they start to go in, and instead of like looking at the big picture, They look at
Right.
their own bias, and I don't know if they even see it.
Right.
So, like as an educator, and you see people learning functional medicine, like sometimes you probably have the same thing happen. You go to a seminar, teach, and someone brings you their card, and they say, like, I'm a hormone specialist, I'm a mold expert. You're like going, oh, so tell me when you were suffering from mold. Tell me what hormones did for you. And they're like, oh, and they tell you the whole story, because you can see it's almost like a tell, like playing poker, that this is the area they had some personal impact on their own personal life with. So what kind of tips would you give to kind of stay away from that bias? Because if someone hasn't really dealt personally with mold issues, that might not be the first thing they think about when a patient comes in, and maybe that's their history. And then
Right.
how do you jump into that? So give us some advice.
Yeah, and I think those mold, I think, gets into there's sort of this tertiary tier that you find yourself learning quite a bit about in functional medicine, because you've gone through so many layers with patients that you're kind of sometimes running out of options, right? And you're looking at the interplay between the outside world and the environment, right? So there's a whole group of things that fall into the like mold category, right? Maybe it's tick-borne disease, maybe it's SIRS, right? Maybe it's various different groupings of autoimmune disease. But I think without a doubt, I think practitioners' experience and patients' experience, I think, is often what brings them to functional medicine, or even just root cause medicine overall, because conventional healthcare or a more limited, narrow approach didn't help them. And I think that's where you teeter, right? You're kind of on that fine line, I think, between walking the path experientially, having your own healing experience, going through what does it feel like to do a detox? What does it feel like to change your diet, right? Which there's power in having an experience going through a certain therapeutic intervention. I think that there's an other side of the line when you start to see those clinical patterns, like Candida, for goodness sake, right? I mean, Candida is a classic, right? Where it's like, oh, well, it's Candida. Oh, that's a Candida pattern. It's like, well, did you test for it? Are you sure? Yes, sometimes Candida is a piece of a case, but is it really the endpoint? Or is it just another immune compromisation and there's something else deeper that needs to be addressed? So I would say caution, Datis, is what I would say. I said, be passionate, right? Often your ideal patient that you're attracted to working with is going to be somebody you can relate to, right? But you got to watch for your own bias there. Make sure that your scope of how you study and you present yourself, balance yourself, kind of. But I think there's a fine line.
Right. And I already know the answer to these because we've had some of these discussions before. So, but the other thing is, sometimes people get really frustrated learning functional medicine, and they'll kind of avoid their whole diagnostic workup and everything they've been taught and how to clinically evaluate a patient. They'll say, well, I don't know what to do, so I'm just going to always start with the gut, or I'm always going to start with toxicity. And they kind of just have like their set routine of every new patient's going to get this. And then let's say that may not help some people, but it's the caution is that's not high level care. That's kind of a place to start if you're really fresh, right? Really green. So talk to us about that, because that's still hanging around in the functional medicine community despite all the education.
Yeah, I would say, like, the term is, when in doubt, start in the gut, right? If you just have no idea what to do, clean up somebody's diet, right? And I would say it's probably, that's obviously way too narrow of a scope. I would say if there was something that you should take away from a functional medicine training, regardless of who you go to school with and trained by, it should be lifestyle matters. Right. And that most likely how you eat, how you move, how you sleep, often your mindset and how you think is partly what might have set you up for where you've ended up in your healthcare. Right. So I would say there is that piece that you have to certainly shine the light on and say, without a doubt, lifestyle transformation often is the solution to working our patients back out. And it's not always the simple steps that get them there, but it's the simple steps that get them started, being able to make behavior change happen. So I think specificity is key. I think there's an intersection here between personalized workup and understanding about your patient and where they're going to go. So honestly, this is where you go back to the timeline, or you go back to taking a good medical history. What was going on at the time the clinical picture emerged, right? And one thing you're great at teaching and functional medicine is great at highlighting is there's unique clinical pictures that start to emerge when you're dealing with mitochondrial challenges or gut dysbiotic challenges or microbiome alterations. There's clinical patterns when you're starting to see the emergence of cognitive decline, for example, right? Or the onset of multiple autoimmune patterns starting to trend. There are certain clinical patterns that we may want to be looking for. And in that space, there's often some general things that we should bring forward and teach them about diet and lifestyle movement and taking care of themselves. It's like healthy living 101 that is so sad to say people just didn't learn that. They didn't learn how to live healthy 101, right? But to take it to that next level, taking it out of lifestyle medicine and truly into functional medicine, here's where the medical detective work begins, right? Where you're making the assumption that, yeah, we're going to work on your foundation and we're going to get you started eating, moving, breathing, slowing down, being more mindful. All that really does need to happen, but there's often specificity that needs to be uncovered. Maybe it's a specific autoimmune pattern that's present. Maybe it's a specific cluster of allergies or sensitivities that need to be identified and removed, right? Here's where we can go to that next level and truly figure out what needs to be personalized for that patient.
Right. And, I think that's the difficult part of functional medicine is there's so much to think through and to go through and think about. And for me, I think when you first start with functional medicine, so I would like to get your opinion on this. When you start with functional medicine, you first start to learn, oh, well, there's oxidative stress. Oh, there is environmental toxicity. Oh, there's the microbiome, there's leaky gut, there's leaky brain. There's all these things that are physiological mechanisms that a person may have with a factor, one of the variables in the chronic disease. And then you get to start recognizing how to test for them and what to do for them. And then when someone comes in, you see like 30 of them and you're like, oh my God, all these things are there. Assuming you're not letting your own bias jump in, you have all these things there. But then at some point you got to get, I think what makes a functional medicine practitioner to the next level is they go, okay, there's 30 things here, but four of these key things will impact all the other ones. And they focus on those four. And I think that's where real functional medicine skill comes in. Like you first have to learn what all these things are. And then once you learn how they are, then you got to learn what's a common pathway of how these things impact each other. And then where would you start? And that's kind of the big thing. And
like, which lever do you pull first, right? Because where do you get the biggest impact, right? And it's like often when you look at those big buckets, right, you're looking at regulating or modulating inflammation, looking at oxidative stress, right? Looking at cellular energy and dealing with ATP production, right? So many of these there are these processes, right, that are so absolutely imperative. There's many things that impact them negatively, and there's multiple things collectively that can start to move those in the right direction. But you are right. Like how many people who are not in a functional medicine mindset would say, oh, patient has migraines. We're probably going to need to be thinking about oxidative stress and inflammation. Right. How often do they first go to, oh, maybe it's an ATP issue, or maybe we've got to go deal with mitochondrialopathy there.
So not only all the years you've been teaching, you've seen people you become friends with at conferences and at seminars and so forth, and you see them maybe first come in and they've never done functional medicine, and then at some period of time they really become very proficient in it and you get to know them. What have you seen were the attributes that made those people transition that way? Because
that's an awesome question. Well, there's two different subtypes, I would say. I see two different subgroups of functional medicine docs that are accelerating. I think there's a whole subset where they are diagnosticians. They are pathway geniuses. Where they really understand and have memorized and do live and breathe in a dynamic working matrix of pathophysiology and biochemistry, where they're often brought in to do specific diagnosis or really high level complex reasoning, right? And we see practitioners all across our field of different subspecialties, right? Including oncology and neurology and endocrinology, right? So I think there is this sort of subset, right? Dr. Michael Stone is a classic example of a nutrition biochemist, right? Who has excelled at, oh my gosh, can you look at these nails and tell us whatever you would know about these nails, right? So there are those who have mastered the craft of their medical detective profession, right? And then there are also those who have really mastered, I would say, the craft of helping people make change, right? Because it's like in our whole field, there's sort of the science and the art and the science, right? Because you can work up the science and you can figure out what is wrong with pathways or the process for a patient, but yet fail to get the patient motivated, inspired to work their way out of that situation, right? And then the opposite can happen. You can have those who are almost a charlatan in the sense that they're coaching to generic goals without specificity, right? Where they're a motivator and they inspire, but they're not actually moving pathways, doing medicine and doing personalized care, right? So I'd say there's two sets of skills, right, that I see emerging in this field. Those who are very good at doing behavior change, because behavior change is hard. It is hard to inspire people to be able to change their diet, change their sleep cycle, deal with stress differently, change their entire social network of unhealthy people, right? So when you kind of look at, there's two sides of this, Tatis. You live in the camp of the ultimate diagnostic geniuses. You're known for it. We all love you for it. The teaching field loves you for it. Patients come to you for it, right? And then there's also this field, I think, of some emerging practitioners who are really driving behavior change in the coach approach, and we all kind of need each other.
Yeah, that's such a phenomenal observation, because, I haven't heard you say that to me before, but when you say that to me, sometimes it just resonates with you, like, oh, that's 100% truth. Like that's for real. That is right on. So let me touch upon that a little bit. So you're right. We do need both. And I totally agree with you that there are the ones that are very good at dissecting everything out and really getting to the diagnosis and the mechanisms. Yeah. But you're right. They're not as good as getting implementation. And that's really where a lot of stuff happens. At the same time,
they're both needed, right? They're both needed. Yeah, they're both necessary.
Yeah. But the thing is, I think you're gonna, if you're like listening to this and you're practicing medicine, you're gonna see like which side you're on, and you have to know you got to lean to the other side some more, because that side's so important. And then also, like, if you get in there with the majority of people, get them to sleep more, get them to eat better, and lots of things will change. Yeah. But also, there's a need to have a diagnosis and a mechanism understanding for the spirit, for the soul, because people need that, and that really helps fine tune a few decisions clinically that make a big difference. So you kind of need both. But I would say I definitely see the trend you're saying. You'll see those that are really okay, got the diagnosis, got to figure it out, and then they just totally suck at implementation and getting the patient to do that.
They're like, here, just read my report and go do that. Just do it.
and for sure, I have friends in that. I'm in that grab, and we constantly struggle to implement, and we try to get them to do it. And it's our battle, because the other side comes easy to us. And for other people, they're so good at the other part of it, and they're not as interested in the other part of it, but they have phenomenal change, even though their diagnostic skills are not at the top level. So it is a really good observation. And I think, so what kind of advice would you give to both?
I think you have to have both, right? And you may not have the inclination to be as passionate about both sides, but I think that's how you know you're doing functional medicine, or you're really dealing with root causes, because you're willing to understand that the way we express disease and disorder, right? It goes back to, for thousands of years, the healers, the docers, the doctors of our communities, right? They always would speak to what is referred to as the sacred tree of life, right? And if you go back, you can see for thousands of years, the tree of life is represented, right? When we were in Ireland together 2 years ago, right? The tree of life is everywhere, right? The symbolism is really powerful, and it's been adapted and adjusted a little bit inside of the functional medicine paradigm, but it really tells this story, I think, about what we're talking about, Tatis. Can I share my screen? Can I use a visual?
Yeah, actually, I want to jump into that, because you've kind of shifted from organizing all these educations on the diagnostic skill, going through the process of it, and now I see you shifted more into the lifestyle part of it. So
I think it's both, to tell you. I mean, yeah. I'm going to push back only because I actually think it's all, right? Because when you are trained, whether you're trained as a chiropractor, an acupuncturist, a conventional MD, a DO, a specialist, right? Regardless of how you're trained, right? You're trained in healthcare medicine to observe clinical patterns, to look at and recognize those symptoms, make a diagnosis, and then figure out how do you eliminate the symptoms and how do you move them, I mean, ideally, away from their expression of disease, right? And that's kind of where the philosophical line gets fuzzy and the arguments can break out, right? Because I can't even tell you how many MDs have said, oh, you have a patient with elevated, thyroid peroxidase antibodies. So what, right? Or they say, who cares? You can't do anything about that. Or really, there's no such thing as preclinical autoimmune disease, right? And it's like, okay, so park that discussion aside, right? And say, look, there are ways that we either clearly see that somebody is expressing disease and disorder, okay? Diabetes, body composition struggles, depression. We see it in clinical symptoms. We can see some of this represented in altered labs, right? So when we, as the clinicians, are working up the patient's history, we think about them as this expression of their inner health and wellness. There's a lot of things that led to this moment in which we're inspecting their tree in the forest, right? And they may have a broken limb. They may have dying leaves hanging from a branch, and that may be their type 2 diabetes and their hypertension, right? Or this could be their gout and their elevated triglyceride pattern, and they're on their way with a metabolic syndrome accelerating their PCOS, right? And so what we see in functional medicine is this beautiful, simple analogy that says, look, we want to observe, where do we have dying branches? Where are the leaves wilting? Where are the health challenges out there expressed? But in functional medicine, we're not going to stop there. We're going to go deep and say, okay, let's now go down into the trunk and realize there were years of development that happened. These tree rings represent years of this individual's life. And in functional medicine, there's something called the timeline that is done to look at those tree rings. How did they live their life and how did they get to this point right now? And in functional medicine, you also go deeper and you observe and you say, look, we also know that the tap roots and the roots that hold this individual grounded into the earth and the soil are also important for their health expressed above the surface. This is called lifestyle medicine. And your roots are how you rest, how you sleep, how you move, how you train, how you eat, what you drink, how you manage resiliency in various different stressful scenarios, and your relationships to yourself and other people. And these are the roots that help stabilize us. And those roots are fed also then by our soul and our soil, which is also going to support and nourish our overall health and wellness. So what is functional medicine? Functional medicine is beautifully represented by the tree of life because it says simply, we do care which branches are broken. We do care where there's death and dying and dysfunction that's presenting in our lab work and our clinical workup. But we're not going to stop there with a name. We're not just going to cut off that branch. We're going to go into the story of that patient. We're going to learn more about them. We want to aid healing and transformation at the level they can do something about it in their lifestyle factors. And then we're going to use the advanced aptitudes that are gathered through the science of functional medicine to be able to figure out where are some of those unique attributes that we want to address or we want to deal with targeted nutrition or pathway medicine.
Great. So this is a really nice illustration of that. And you're teaching practitioners and patients these concepts at Docere.
I do.
What's the name? I
do. Yeah. Yep. Our company is Docere Vita. Docere, as everyone recalls, is doctor, right, in Latin, and docere means to teach and to educate. Yep. Right. So docere, to educate and inspire, and then vita is vitality. So we are teaching our courses to patients, and I do mentorship programs with healthcare providers who are really working hard on the art of good medicine. Right. And so that's what we do at Dr. Christy Hughes, Docere Vita.
Great. And this model you presented of both sides of this spectrum that we need, I mean, this really does help support that combination of how important these things are. So that's another clinical attribute, is just the ability to get the message to your patient. And we've all seen like the super total geek nerd biochemist expert that can do functional medicine, but the practice is failing. They're not doing well. They don't have patients that follow along, and they don't understand like just because you said it doesn't mean it's going to make an impact.
100%.
You have to figure out what the patients are. Yeah. So what suggestions would you give for people that need to understand that more, of how important it is you connect with them and discussion? Different people do it differently. I'll share with you how I do it, but I want to hear your opinion.
Yeah. Oh, I think you have to connect authentically to what works for you as a provider, right? There are honestly, there's physicians who are brilliant at pathway medicine. They do an amazing job at figuring out what's wrong and writing these brilliant protocol-based plans that are unique to that patient. Honestly, that's what they should be doing, right? But then they often need somebody on their collaborative care team to explain what in the heck you just wrote and what do you want and when are they expecting to see you back, because a lot of people in that mindset are already on to the next problem to solve, right? Because their strength and their skill is their detective work, right? It's problem solving, right? And what really gets them excited is solving problems, right? And so that's an important skill set to have in functional medicine. Great goodness, it's probably one of the most important skills, right? Along with curiosity, right? So if you have curiosity as one of your character strengths, you want to know. You're going to ask more questions. And in functional medicine, you ask really specific questions because you're listening. You're listening to the story and you're asking these questions because you want to know more. Tell me, how did that happen? Tell me what happened before that happened. And in developing your coaching skills or your communication skills, you're learning how to strengthen that rapport. You're learning how to improve the trust factor. You can do that very quickly and in an authentic space, right, with the patient. And in functional medicine, how often there's a deep mental or emotional or sometimes deep trauma, that's underlying someone's depression or someone's anxiety or someone's insomnia, right? And so being open, you're a practitioner creating the space for the patient to be open and really tell them their medical history. And that's part of the story, right? Because some physicians aren't open to hearing the whole story.
Right. So, I think one of the real life situations I see a lot of functional medicine practitioners in is they don't do enough follow-ups regularly enough they just assume, okay, here's the plan. Go do it. And that is something that has been a reoccurring lesson other experts like yourself have mentioned. And I just want to highlight that. And the other one is this insecurity of or issue with not scheduling enough time to really make sure they get it, and also charging for your time, because a lot of functional medicine practitioners, they kind of think, well, I did my workup. That was what you paid me for. But this other time consulting, they don't see the connection there, and they don't schedule enough time to really get that message across. Now, some people have done like group things. Some people have done emotional things, but what's your recommendation as far as follow-ups? And once, let's say you've done that diagnostic part of whatever skill a person's at, and then they have to really communicate to the patient. What do you recommend as an amount of follow-ups? How often should they talk? What's a good time?
I think it depends on the complexity of the case, right? And if they're one of those cases walking in the door and you're the 14th functional medicine provider they've seen, it's going to take you a little bit to uncover that history, right? So sometimes these loaded, complicated cases come in, and it may take you, honestly, a couple of visits to even get the whole story down, right? And look at old labs, review what was there, and then decide, well, what are the new updated labs you do want to see that are relevant, right? So I'll often find it's sometimes a 1-2 punch for me personally with more complicated cases, because I've got to gather data. They're paying me for my detective work of their previous history, getting that data understood, and then going forward and doing the next level of workup, right? So once that piece, I'll usually find it's a 2 or 3 visit before I've gotten everything that I've wanted updated. And it may even take 6 to 8 weeks to get everything in front of me from the very first minute that they've walked to the door or they set up an exploratory call with me. Right. So, when that comes back, then we're able to, kind of move forward. I try to get people in personally myself right away for a fast exploratory call so I can get things into motion versus having them wait 3 months to see me. All right. So we try to get people engaged in some action steps, but there's work that can be done, while you're waiting. So you as a practitioner, once you arrive at that point where you're ready to move forward with the patient and you have a working plan, if you're doing functional medicine, the plan needs to change. They're going to be moving through different levels of care, which will often mean that you're going to move them forward and advance their care. So you absolutely should be checking in with them about every 6 to 8 weeks, because if they're doing the program, things have to be getting better. And as things are getting better, you lower doses or you adjust where they're going. So, I don't know how you can do functional medicine to tease without having that ongoing pulse point and follow up with patients.
Yeah, and this is one of the really real difficulties that doesn't get talked about, because we're always so focused on the diagnosis and the mechanism and the intervention. Mm-hmm. But really, the second half of clinical care is, okay, you figure that part out, or you want to do it. Maybe it's taking you a few sessions to get to where you need to go. But then once you get there, the implementation and then how to get that information across the patient, right? And there's a lot of insecurities with practitioners of charging and time for that, and enough follow-ups. Mm-hmm. And if they don't do enough follow-ups, and if they don't do enough education information, the whole case can pretty much be wasted. The whole thing is
it's pointless, right? Because at that point, you become their accountability coach, whether you like to call it that or not. That's who you are, right? You or someone on your team needs to be checking in. How are things going? What's changed? What's left? Symptoms improve and disappear all the time in functional medicine. And there's labs that need to be followed up on, right? So you have to decide you're either going to be doing a VIP concierge practice, right? Where you've got one big price point and then you just manage whatever people need. Or you do parts and labor and you charge people for what do they get from you and how much time do they have with you, right? But you figure out one of those models. And some people will do group education. I'm definitely doing more and more of that now, where I'm doing more of my general teaching and general educating to my entire patient base as more of a group model. And then I'm doing the one-on-one care and decision-making in their individual sessions, right? So I think there's some great opportunities right now to teach. COVID and the pandemic accelerated a lot of telemedicine and strategies for doing distance care. So I think that practitioners have more flexibility now than ever before, but they also may be overwhelmed and confused because they have more choices than ever before.
So when you figured everything out and you're consulting with the patient, what's the most important thing you want them to leave that first session knowing? Is it's a process that's going to take time? Or, this is your goal do you set a goal, follow this goal between next time we're going to talk in X amount of time? Or I want you to understand the big picture. What are the things you want to get?
I want both. One is I need to know where their big picture goal is. I need to know what they consider success, right? Because that's what they're going to be holding me to as their consultant working with them on the case, right? I need to know that in order for me to help them get there, they're going to have to change some behaviors. And in order to do that, it's often a negotiation, right? It's a conversation. And, when you have that doctor dictator hat on and you're telling people what to do, you're telling them to stop the Coca-Cola, you're telling them no more Starbucks, when you are telling them what to do, their little inner 3-year-old has this massive tantrum and it doesn't want to be told what to do. Adults don't want to be told what to do either. There's this little instinct response that just really rejects being told what to do, right? So here's where coaching techniques that physicians and healthcare providers use is important, right? There's all sorts of strategies for how you have the same conversation, but you're offering up solutions to their challenges and you're giving them suggestions and ideas for how they can accomplish their goals, which is not the same as Dr. Dictator and telling somebody what to do. Right. So you have to have more skill sets to teach. You have to have some background in behavior modification. You have to be patient and you have to allow for that conversation. It's like parenting. You got to allow for the conversation to develop because you're trying to teach them how to fish. Right. And you either are the one that does that or somebody on your team, somebody on your clinical team can do that. But when they leave, they have to be connected to why they're there. They have to be connected to their passions. They have to be connected to their healing goals. And they have to feel like whatever baby steps you're giving them or you've both agreed on that they're going to take, that they're achievable, that they want to attain them, and that they can see why those steps are going to march them closer to their goals.
Yeah, there's a couple of really important things that you brought up there. I really want to just highlight that for everyone. So one of them is you really know what their expectations are. Because, sometimes you'll do a history and the patient go, well, what do you expect? Then go, when was the last time you felt normal? And they'll say, oh, when I was 25. And they're like 50. And you're like, well, that may never happen just because of age. They may have really unrealistic expectations, I just want to be able to eat every food I ever wanted to like I used to. You have celiac disease. That might not be a possibility without some reactions. Your body will tell you. You don't have to be theoretical about it. So, so I think that's a really key thing that you brought up is the importance of really establishing what do you want? Like what's realistic? What are your expectations? And then the second part is no one wants to be told what to do. And I think just sometimes sitting down with going like, this is what you have. Like, what can you do? And if you do, what do you expect? And then what kind of and then you have that like real, like almost like a one-to-one friend conversation, right? Versus you telling him what to do. Like, what do you want? Like, if you're not going to go off a liter of Coca-Cola, like we can't get your blood sugar down. It's like,
right.
It's okay. It's okay. You can have to do it, but let's figure out how we can,
Right. So last week, this happened to me literally last week. I know you've had this many times, but this one was like one of the most profound ones I've had in 24 years of practice. So we have this extremely wealthy gentleman who comes in here, concierge care. We love working with him. He's the sweetest guy. He loves his tennis game. His tennis game is really where a lot of that, but he comes in, he does boxing, he trains here in the center with us, and he suffers from arthritis. So I wanted to look at an antibody panel with him. I wanted to look at foods. I told him, look, can we please at least just look at your diet and pick up where there might be any kind of triggers where a diet could be provoking inflammation. So we get a food report back and we are having this discussion, but it would be great if he would modulate his diet a little bit and we could see if we could pull down any of the associations between these foods and the trigger connections. He cannot believe the fact that beef is on the list because steak is his favorite food and his second favorite thing is red wine. And oh my gosh, if grape is on there, forget about it. Because if this report means no more steak and no more red wine, well, forget it. He'd rather have the joint pain, right? And it's like, it's so fascinating to me because I rewind, like 2 weeks before. And here's this gentleman telling me, I will do whatever it takes so that my game is better, that I feel better. He flies all over the world. He plays tennis and golf everywhere. And he just wants to feel good, but don't touch my red wine and my steak.
Right. So in a situation like, in a situation like that, what would you do? What did you do? I can tell you what I would try. And then
Right.
for me, I would say, listen, it's just a working diagnosis. It might not even be real.
Yep.
Why don't you give it like 30 days? Yep. And if it works, then then you can always go back. It's not like you're committed to this rest of your life. But
I
then
even went for 21 and then I even went for 14, right? It's like, seriously, you can't just for 14 days not have a glass of wine and eat steak. And like, there's so many other things you could try. But you know what? It is so interesting how often people have what they think is their goal. Yeah. Right? This is what I think I want, or this is what ideal health looks like. But don't make me change what I do. Yeah. Right. And you have to listen for that, right? Because there are some times where, you know what, you can't always inspire and move everybody. So you got to find a different hook. Right. And then you got to dig deep into your coaching basket and you need real skills to get to these people.
Right. It's very true. And also over time, you have more influence, like a new graduate telling a person to try something versus someone who just has this experience telling them the exact same thing. There's a vibe they have, there's a tone they have, it's an impact. And with situations like that, in my practice, I've had times where I go, listen, there's some changes you need to make. I don't know if you're ready to make them yet. Yep. You may not be sick enough yet for you to be motivated enough to make those changes. I'm here. Yeah. When you're ready, please come back. I just don't know how this model can work unless you make some of these changes.
See, I don't even give them the loosey-goosey. When I literally am like, look, there's stuff we got to do. We just need to set up this window and figure it out. I said, we got to do some detective work together. Yeah. I said, I don't expect you to walk out the door and make these changes today, but I do want to know if you're okay with where we're trying to get. Said, and then we together need to figure out when is your day one. And I tell them, I don't care if it's next Monday and I don't care if it's November 1st, but I do care that we come up with a window and we say, we're going to try to be perfect or close to perfect for these X amount of days. And I always want 21 to 28 days, right? Because I want them to do the best they can with eating, moving, sleeping, and giving me a window of time that I know is transformative, right? And I would rather nurture, teach, go into their house, send my nutritionist to their kitchen to throw all the junk out. I would rather do more of this warm-up band and then do it really well because they're ready. They know why they're doing it because we're going to get way better results if we really do the plan.
Right. And there's something to be said about having a person give it a trial so they can actually see how they feel. And the importance of saying, this may not be for the rest of your life, but this is something that will help, I guess, differentiate how much of an impact is having on you. And if it doesn't have any impact on you, then that's fine. But if it does, then at least you know, and then you can decide to move from there. But you should at least have the understanding of how these things are impacting. Right.
And I always love those moments too, where I tell them, you may not live here forever. I may not be your provider forever. I said, but when these symptoms do come back at some point, I want you to know why they're coming back, right? Because you added these back in or your behaviors went back to old trends, right? So I'm forever trying to connect the dots so that they can be more mindful, right? And realize that it's what they did that made all the difference. My job was just using curiosity, my love of pathways and my love of learning to help them figure out what levers to pull.
Right. And I think it's really important too, is everything is a working diagnosis. Like you don't really know, like how you respond or don't respond for the next, let's say 28 days will tell us a lot.
Yep.
And if you don't respond with removing all these foods, and there's for sure something besides foods that is a trigger that we haven't caught. And And that's where you have to go deeper. Or like this could totally reverse everything for you. And you go, okay, it's these foods. And then that at least you know that this is the impact it's having. And then that might give you, more information for you to base your lifestyle and everything with. But you have to, everything, we can't just tell from philosophy of nutrition and diet. We can't just tell from labs. There's a point where how your body responds, either good or bad, is going to tell us where to go next. That's right. So that's critical.
Big time. Tracking is key, right? Which, they're paying you in the beginning to work them up, right? And get a starting perspective. But where your real expertise comes in is being able to finesse the plan and keep moving them through the reversal of disease, right? Because they go through layers. They go through literally locks and gates where patterns clear and things go away, right? And then it's, well, what do we keep doing? What do we stick with? What do we stay on? And when are we done with a certain process? And that's where your expertise comes in. That's why they need to keep working with you.
Right. And if you look at those two groups, the mastermind clinician that doesn't have very good coaching skills and lifestyle change and impact, and the ones that have really good lifestyle impact and very poor coaching skills. Let's talk about the ones that have really good coaching skills and can really focus on, everyone's going to come in, could probably move more, could probably sleep better, could probably focus on life and loved ones more and work less. Like that's a common theme, right? Like we all have, we can all improve, and it's a work in progress for all of us. And then at some point, like if they've gone through those things and they're not getting better, like what's the word of encouragement for these people that are very good coaches, but really not the best diagnosticians, right?
Yeah. Well, and I think, no question, I think at that level, it's like, is it a referral? Because if that's not their specialty and that's not what they want, they need to be able to do a referral and a handoff to a functional medicine provider, say, hey, look, we've addressed X, Y, and Z. I don't think they have to be the one. I really don't, honestly. If that's what they're really good at, get good at knowing when you're not the one. Get good at referring and build a network of people around you, right? And a lot of the deep work we do with working with your roots and your history and your timeline and uncovering who you are today based on where you've come from in the past, right? That can bring up trauma. That can bring up some painful moments. I am not the trauma therapist, but I'm absolutely going to be referring to the trauma therapist who's going to work with me in collaboration. So honestly, refer. In Minnesota, there's only one Rick Mayfield and one Dr. Tom Salt in the Midwest, right? And there's certain cases I get to a certain point, I'm suspecting tick-borne disease. Yeah, there are a dozen people who call themselves Lyme experts in my area. I'm sending them to Dr. Tom Salt because he's going to use a functional medicine mindset, right? Or somebody has an environmental toxicology case. I'm going to send them to Rick Mayfield, right? Because no matter how much others know about detox pathways, they don't know it better than him. Right? It's a neurology case. They're sending them to you, right? So I think there's also the space of strengthen areas that you like learning, that you're going to be curious about. They're going to spark your excitement, that are going to keep you leaning in more, right? So as a clinician, if you're more coaching inclined and behavior change inclined, maybe there's a group of patients you're more attracted to. Maybe it's women's healthcare. Maybe it's infertility. Maybe you have passion for PCOS, right? Or maybe you want to work with the autoimmune cases and your passion is for thyroid disorders, right? Then what I would say is get really, really good at that condition and the things that touch, surround, and in the web network in functional medicine intersect with that condition, and go deep in those areas, if that makes sense. You don't have to be good at everything, right? But if you're going to specialize, then learn the science and get deep into the pathways surrounding the conditions you're excited to manage.
Right. And it doesn't have to be totally polar either. If you're good at diagnostic, just get better at your coaching skills. If you're good at coaching, get better diagnostic skills. And then at some point when you need referral. So
and build a team. Don't be afraid to build a team, right? You got functional medicine providers all over the world. Work together.
Okay. Two last things. And I know you're busy, but one of the things that I want to ask you is, so what do you do when you have a team and everyone's trying to treat the patient differently? And that's a situation that happens quite often when people start working together, and like, who's in charge, what's happening, but now the patient's confused. Like, what do you do?
I see that as much. And it might be just how we set the stage, right? But I'd say I do a lot of telemed consulting, right? With functional medicine doctors who are in other states.
Okay. So well, let me give you a different example.
Okay.
I seek out famous Dr. Christy Hughes for advice.
Yeah.
We sit down together, you create a structure plan, you implement, you teach me everything. And then we do a follow-up, and I say, I went to see Dr. X, X, and X, and they told me this, and I've been trying this supplement. And they think I have this. And I also went to see Dr. So-and-so, and they think I have this. Now I'm trying that. And then
I have like 10 of these patients. Sorry, I don't mean to laugh.
You don't have those? Oh, you do?
I currently have like 10 of them. And then I'm like, and then somewhere in the line is always, and I went out and saw Mark Hyman. So I just.
Right. So what do you do?
I do have those cases. I don't take every case that comes at my door, period.
That's right.
Period. It's been very hard. I've been in practice for 24 years. 97 is when I started. And I have to say the hardest thing I've learned as a practitioner is saying no. And saying, no, you're not the right case for me. And I'd say I'm still going through that. I'm really learning who is my ideal patient. Who do I really want to work with? And I think there's subgroups of patients that tend to get a lot of unhealthy feedback for their victimhood mentality, right? I think there's certain subpopulations of patients where the wrong groups or the wrong leadership for those groups, pain patients, chronic fatigue patients, infectious disease patients, right? Where they can bring each other down and not bring each other up, right? I think there's certain areas where, you got to pay close attention to who's their social network, whether or not you can even help them or based on what their home situation's like. So hence, don't take everybody.
Right. And that's a really, I think, skill of very experienced clinicians. They really know how to pick patients that are most amenable to the care they provide for them. And if they're not, they will just not work with them. And that's for their patient's benefit. It's not for anyone else. It's like, you're not going to respond. It's not going to work this way. So let me tap out. So,
completely. And it's interesting because that also changes, I think, over time. And it changes with your own life experience. And I think it's important that we always remember that that's okay. Like you don't have to see everybody. You could really have a group that you want to focus on, and I think part of the business rebirthing that I've been doing with Docere Vita is really figure out, well, who do I want to spend my day with? Because I can tell you that I cannot spend my days anymore with fibromyalgia patients and chronic Lyme cases because it's exhausting to me. Right. It's triggering for me. Right. And so it's like, I had to tip my scale and say, look, who do I want to sit across the desk from me? I want health conscious, active parents who want to raise healthy kids that move their bodies a lot. Like I want to treat and work with other skate moms, right? Like literally, I want moms for my patient base. Right. And so I was like, part of my burnout factor was me learning that there comes a point where it's actually okay for you to figure out who you want to work with. Right. And the kind of cases you want to work with. And I think that's another next step, Datis, that comes with, it's a separate skill than mastering the science and then mastering the art. It's also mastering what you're really good at and how to do your job and prevent burnout.
Yeah, that's a big thing everyone has to learn over time. Okay, last question. And this is a question I've been asking everyone that I've had a chance to interview. All right. So there's two types of people in our group, those that are very new to functional medicine and still learning, and then those are very advanced and really they're the ones that will sit around for 20 hours just to get one nugget of something new they haven't learned. And they're at a different level, right? So what kind of advice would you give someone that's new, trying to improve their skills as a functional medicine practitioner and not burn out in practice and all the things involved with it? And then what kind of advice would you give the experienced ones with your background?
Yeah, awesome. So I would say in hindsight, nutrition is one of the first places to start. So if you're coming into functional medicine and you need to really kind of pick something to get connected to and find passion around, find food first. Food is the variable, obviously breathing and food and water intake, but start with food, get great with nutrition and continue to expand your way out. I think if you teach people how to eat right and pay attention, be mindful of all of those lifestyle factors, you move the needle so far and so fast that it gets you some great traction, and you as the practitioner start to see the power of lifestyle change, that there is so much that you can do if they can make those changes happen. And then give yourself the grace and the space to develop all of your knowledge in the systems and the pathways. Pick areas that you see often. Maybe you want to start with hormones, or maybe you want to start with metabolic disorders and cardiovascular disease, or maybe you see a lot of fatigue patients, pain patients, and cognitive patients, right? And you're going to go after mitochondria. but pick a place to really start to study deep into the science. Pick it around conditions or syndromes or pathways that you're going to treat often and that you also really enjoy learning about, because it's the depth here that really matters. So learn lifestyle first, learn food as medicine first, and then start digging deep into areas so that you can get comfortable managing that cluster of conditions and then expand into the next groups. I would say if you're really an expert in advanced biochemistry and advanced functional medicine, here's where you kind of need to step back and step away from the pathways and really ask, why are my patients not getting better? They're not getting better because you're not smart. They're not getting any better because you're not sitting with them, you're not listening, and you're not connecting with them and what their needs are. And I'd say, and then you go down that pathway and find a passion for connecting and listening.
That's great advice, especially for the advanced ones. I think it's so right on. Anyways, thank you so much, Christy, and people now know about your shaking the tree model, and they can connect with you if they would like some help there. And thanks again.
Sounds good. You can find me on LinkedIn all the time. So I'm my professional page. You can find me if you have questions, let me know, but I'll be playing somewhere on the functional medicine space.